Hello friends, myself Dr. Maddineni Srinivas and this is the skin MCQ of the day. A 27-year-old female came with the complaints of grade 3 acne, that is mainly pustular lesions, and topical retinoid and oral doxycycline were started, which is an appropriate treatment, but there was no improvement. So now she is branded as a recalcitrant acne. So what is the next best step? So if you know the answer, please leave your answer in the comment section. So let us look at a few points about what is recalcitrant acne. So please remember, this is taken from Wolverton textbook. So you can see recalcitrant, FDA has defined it as inflammatory lesions larger than 5 mm diameter and unresponsive to conventional therapy, including systemic antibiotics. So if a patient is not responding to the normal conventional therapy, like as in our case in the question, so then we call it as recalcitrant acne. Then what is the FDA guidelines? We can start the patient on isotretinoin. So if you have marked the answer as option B for this question, you are absolutely correct. Stop the topical and oral agents and start the patient on oral isotretinoin. Okay. So a bonus question for all of you. This was one of the question asked one of my group members. A 30-year-old female came to us with moderate papulopustular lesions on her face. She was started on topical antibiotic and topical retinoid. So she was started on this 2 to 3 months back. Okay, by some other dermatologist, she was started on this. Now she is coming with, she did not have any significant improvement. So the lesions are still persisting. And now she is clinically in moderate papulopustular variety of acne. So what change in the treatment we should do to her so that there will be a better outcome? And if you have marked the answer as option 1, you are absolutely right. Why? Because let us quickly see this algorithm, which is Global Alliance to Improve the Outcome in Acne. It was formulated by various members in the conference, and this is the algorithm which we can follow. This is a bit difficult, most likely examiners might not ask you in this depth. So just remember mild, moderate and severe. So mild is going to have comedonal lesions and papules and pustules, whereas in moderate variety the papules and pustular number, the lesions can increase and there can be nodular lesions as well, whereas in the severe form there will be more number of nodular lesions. So in the mild papules and pustular variety of acne, we can give topical retinoid and topical antibiotics, like which was given in this question, topical antibiotic and topical retinoid. But now the patient is coming to us with moderate type of papules and pustular lesions. So this is the place where the patient is falling. So now what we have to do, oral antibiotic and topical retinoid should be given. So among the given options, option 1, switch the topical antibiotic with an oral antibiotic is a proper option. So this option 1 is going to be the answer in this particular case. I hope all the students and the student particularly who asked this doubt, your doubt is clarified. Okay. Thank you so much. You can ask these kind of queries in my Telegram group. I will try to cover them in the form of the video explanations. Okay. Thank you so much. Happy learning dermatology. Sarvam Sri Krishna from Sarvejana. Sukhino Bhavantu.